Hey guys, now toward the end of the integumentary system unit, that you've learned all the parts of the skin and how those things work, we're going to talk about what can go wrong with the skin. So there are 1,000 different things, conditions, and ailments of the skin. Most of those are caused by common things like bacteria and viruses. So just a nuisance. They're benign growths, which means that they're not cancerous or harmless, and they don't metastasize, so they don't spread throughout your body. An example of that would be like a wart. So it's a growth on your skin, but it's not going to cause you any problems. It just might be a nuisance. There are, however, some things that should be of concern, and we're going to talk about each one of those in depth. So basal cell carcinoma, squamous cell carcinoma, and melanoma. The first type of skin cancer that we're going to look at is called basal cell carcinoma. It originates in the stratum basal layer of the epidermis. It is the most common, but it's the least aggressive. If you look at the diagrams, you'll see that the lesions typically are kind of rounded. They're elevated off the skin. They're usually shiny, and they might be kind of pinkish in color. If they are allowed to grow for a very long time, then the very center part might become kind of like an ulcer and have like a pearly beaded area around it. They are treated by surgically removing them, and they typically only affect the tissue in the area where they're located. So very rarely do we see these metastasize in the body. Second type of skin cancer is the squamous cell carcinoma. It originates in the stratum spinosum layer of the epidermis, and it's the second most common form of skin cancer, a little bit more aggressive than the basal cell carcinoma. So it does have the ability to spread throughout the body a little bit more than what we would see with the basal cell. If you look at the diagram, the lesions are usually a little bit raised. They may have scaly patches on them, kind of look like a sore. And the basal cell and the squamous cell are most commonly found on the head and the hands because they receive the most sun exposure. Treatment is the same as it was for the basal cell. Surgically remove the area, and the cure rate is high when that is done. The type of skin cancer is melanoma, and it originates from the melanocytes of the epidermis. It is the most dangerous skin cancer because it's very aggressive and it has the ability to spread through other parts of the body. So highly metastatic. It travels in the bloodstream and it also travels through the lymphatic system. So it's also resistant to chemotherapy and radiation that are typically used for other forms of cancer. The American Cancer Society stated that one person dies of melanoma every hour in the US. So if it's left unnoticed or untreated, it can be fatal. It's usually found in existing brown patches. So the two moles shown there are examples of melanoma. And as we talk about some of the characteristics of melanoma, they fit most of the categories that we'll discuss. But the melanoma is not always found in a pigmented area. So they've definitely found those in other places. Early detection is key to make sure that you catch it early, so the success rate is higher. As far as once it's identified, for example, these two moles would be surgically removed. It would be a bigger area than the basal cell and the squamous cell, but if it was caught early enough, then the cure rate or the survival rate would be high, just like the other two. If it's left for just a little bit, it has the ability to spread like wildfire through the body, and then it can be problematic. One of the things that I'll stress all year long is that you need to be aware of your body. So everybody's body is different, and you're going to notice if there is a change. So once a month, check your skin. It's very important to create that habit and start to take note of, what's normal for you and if anything shows up that's not. So a good rule of thumb is something called the ABCDEs of melanoma, or just of spots on your skin. And this chart's a pretty good representation of that. So if the border is not symmetrical, that should be of concern to you. If the border, if you go around the edges of it, and they're uneven in one area or around the entire pigmented area, then you need to keep an eye on it. If you're looking at it and you notice that the color's not uniform, there's more than one color, there's some weird colors in there, that would definitely be something to note and keep an eye on. If you put a pencil eraser over it and it covers it, should be okay. If the pigmented area extends beyond that pencil eraser, then it's big, and that should be something to keep an eye on. And then if you notice any kind of change, so it may not be big, it may not have a lot of different colors, it may not be asymmetrical, but you've noticed a change, that would be of concern as well. And you would need to seek medical professional for help.